All right, it is 1:15. I want to say a big hello to everyone tuning in. My name is Dylan Huffpower, and I am an admissions counselor here at the Tulane School of Public Health and Tropical Medicine. I'm so excited because today is one of my favorite things. It's a webinar with a faculty member working currently here at Tulane. So each week I'll be coming at you live from Facebook. Today's our first one during our Pathways to Public Health webinar series. And today I've got Dr. Charles Miller, who is going to be talking and answering some questions about how did he find public health, what is he currently working on, and his role at Tulane. So I'm so excited for all of our viewers today. Dr. Charles, can you introduce yourself and give us a little bit of information about you before we go into too much detail?
Yeah, thank you, Dylan. So I go by Chuck. I'm Chuck Miller, and I'm a professor and the interim chair of the Department of Environmental Health Sciences. And some of you may not know what environmental health sciences actually is. And so in environmental health sciences, we're a branch of public health that looks at the different environmental media that people come in contact with. So we're interested in the quality of the air that you're breathing, and we're interested in the quality of the water that you drink, and the soil and the sediments out there where our food grows, and the food itself. And so those are the ways that the environment can influence your health. And so we try to make sure that all those things are good and that they promote your health rather than harm you.
Absolutely. Thank you for that. Can you talk a little bit about, I know you wear a few or more than one hat at Tulane, but maybe specifically about some courses that you teach, because I know it's a handful of courses that you teach. So can you talk a little bit about those and I guess a bit more about your specific role within environmental health and what you do at Tulane?
Okay, so teaching, I teach several toxicology courses at different levels. And I also teach undergraduate and graduate students. The toxicology courses I teach are from introductory undergrad level up to advanced doctoral level courses. I also teach a course in chemical risk assessment. And so when you know a chemical is in the environment, how much of that chemical can you determine should be in your water where it would be safe to drink, or in the air that it would be safe to breathe, those types of courses. I'm an interim chair of the department, so I'm sort of taking care of the business of the department and how the department interfaces with the other departments within the school and within the university itself. And research-wise, I'm still doing a little bit of research, mostly wrapping up some papers that I've been working on right now. And so I can tell you a little bit more about my research. I've got interested in research when I was a sophomore in college. And at that time, saccharin, the artificial sweetener, was an interesting chemical of interest because it was being put into diet sodas and diet food.
Right.
A lot of people were weight conscious and, oh, if I can eat these diet foods, then I won't gain weight. And it didn't turn out to be that simple, but the concern was that saccharin might be a carcinogen. So I got interested in chemicals in their food, water that way. And today, I and lots of other people think that saccharin probably problem. And that's sort of what got me into the field of toxicology, and I've been interested in that ever since.
Well, my next question was actually going to be, how did you find public health? Because in my experience interacting with prospective students, we do have some students who don't necessarily stumble upon public health or a passion for it until later in life. Maybe that's at the end of their undergraduate career when they're studying something completely different. And sometimes it's non-traditional students who have a life experience or something else when they're already working professionally that drives them to public health. So can you just talk a little bit more about maybe, I know you mentioned how you came about the research and your interest in environmental health, but more
Mhm.
specifically public health. And I guess what advice would you have for someone who is just coming and stumbling upon public health and they don't really know how to pursue it yet?
Yeah, so the good thing is to take a course in public health. That's an obvious way to be introduced to it. Um, so we're able to introduce you at the undergraduate level and the graduate level to public health. It's been a great career for me, so I think it's a really good uh, career choice. Uh, you never know how life is going to turn out, but I don't think it would ever be a bad choice for anybody to be in public health. Uh, so I can tell you a little bit about what I did as a student. I worked through college in the area of health research, not particularly public health, but I've spent a lot of time studying cancer and carcinogenesis and mutagenesis. I've been interested in this field uh, for a long time. What I've learned is that a lot of the things that we're exposed to uh, in our environment are choices that we make rather than choices that we don't make. So much as air pollution, your exposure to that is not a choice, but you do have a lot of health promoting choices that you can make during your life and things you can control. And those, in my opinion, are probably more important. So what you choose to eat and drink and your lifestyle, getting vaccinated, simple things like that turn out to be really important public health steps that you can take to improve your life individually, and it improves the public's health as well.
Absolutely. And I think that's an interesting point because even since in the time that I've worked here, I've realized how many, as you said, choices that we all make that are directly related to our public health and to the health of people around us and to society. And you don't really realize that until you're in the world of public health or you have some knowledge of it. And I think your background, which has brought you into the world of public health, is really unique. And I'm glad we've had you because there, like you said, there is no one correct way to come into the world of public health and to be successful. There's not necessarily the perfect job or degree or path. So that's exactly what I wanted our viewers to hear is that whether you're interested in environmental health or you're more of a numbers person or um, going out and being in the community in some way, that you can pursue that here at Tulane, which is really cool. Speaking of Tulane, can you talk about your experience as a member of the Tulane community, being on faculty? Maybe you have worked with students on a specific research project, or just anything about being a part of the Tulane community that stands out to you.
Yeah, the Tulane community, I think, is very collegial. That's the way I would describe it. It's very easy to work with other people here. Um, there are not barriers. I went to school at New York University as a graduate student, and I was excited when I got into New York University, thinking, I'll be able to talk to this professor, and I'll be able. I never saw those people my whole career there. So here at Tulane, I think you can have access to people. We're much more accessible. I think the university and our school in particular prides itself on interactions with students, and instead of being remote and aloof, I think my door is always open. You can walk in and see me anytime. That's the kind of atmosphere I find here. So we're much more accessible, I would say, than a lot of other places. And I think we have more interest in our students. That's sort of the motto of our university, is that it's not for ourselves, but for our own, and our own is our students. So we take a lot of care in our students and nurture them.
Absolutely. And I know you said you went to New York for graduate school. What do you feel about living in New Orleans? Obviously, the food, the music, the people, things are different because of COVID, but is there anything you want to tell our viewers who are not from here about getting to live in a place like New Orleans?
So I've lived in some larger cities. I lived in New York, and I lived in Houston and Buffalo and Birmingham, different places. And
A little bit.
out of my limited experience, I like New Orleans the best because it has a lot to offer, but it's not a huge city. It's easy to get around. A big rush hour here is 30 minutes usually to get across town. So I like that aspect. And at the same time, we have pro sports. We have an active theater scene, all kinds of music and food. And so, pound for pound, New Orleans is a pretty good place to live compared to other cities to me. It's also not as expensive as a lot of places. So it's more toward the affordable end of places you could live in the country.
More affordable is always a good thing. Before we end, if anyone watching has any questions, feel free to drop them in the chat. And Dr. Miller, do you have any last advice or any other research or anything else that you'd like to share with our viewers?
Well, I'd like to get back to the idea of public health as a career. And I think that, we have the old saying that when public health is working, nothing happens and nobody notices. And today, people are starting to notice because things are happening. And so we have a pandemic, we have climate change. You can find disparities, haves and have-nots in the health system in the country. And so there's just a ton of opportunities in public health. And so the salaries are good. It's a good career choice to make. I would recommend exploring it.
Absolutely. Like Dr. Miller mentioned, there's no lack of public health disparities happening currently for our recent graduates to be taking the lead on. So lots going on, lots of opportunity, and we'll help get you there at Tulane. So I just want to say another quick thank you to everyone who joined us today. I know this was pretty quick, but this video will be put on our YouTube page, and it's also going to stay up here on our Facebook page. If you go onto our website, you can find Dr. Miller's email address, as well as my email address, if you ever want to reach out to us with any other specific questions. And you can also always contact the admissions office by emailing sphtmadmissions@tulane.edu. And we'll be sure to get in touch with you as soon as we can. But thank you all for viewing, and I hope you guys have a great rest of your Monday. And thank you, Dr. Miller, once again.
Thanks for the opportunity.
Yes, sir.